All right, welcome back. So today we're going to start in on the immune system. So with that, I'm going to hide myself and let's get going. Please, computer, let's get going to the next slide now. Bye. Woohoo. All right, so we're going to be talking about innate immunity, which is basically, and you can read this here, it's non-specific because basically they're going to guard equally and essentially the same way against a broad range of pathogens. Okay, and their effectiveness does not depend on prior exposure. So if you have some kind of foreign microbe come in, it reacts this way. Comes in again, it reacts the exact same way. It doesn't modify its response in any sort of way. Okay, we have a first line of defense and our second line of defense. This will be pretty obvious, especially at that first line of defense, how that works. Then we'll talk about adaptive immunity. And adaptive immunity, our discussion about adaptive immunity will be the bulk of what we talk about. All right, so we're going to start with innate immunity first. So in that first line of defense, we have our skin and our mucous membranes, right? That's our first line. I think if you were in my class last semester, I talked to you about how important our skin is and how important that keratinized stratified squamous epithelium is, right? So basically, that keratin is a very good barrier to different microbes, right? And that's one of the issues with like burn victims. When they lose that protective skin layer, they're actually subject to lots of systemic infections. That second line of defense, those are internal defenses. So those are going to be antimicrobial substances, natural killer cells, phagocytes, inflammation, and then fever. Okay, and we'll take these step by step. All right, so first line is simply the mechanical protection that your skin gives you. Again, as I mentioned, these keratinized cells, not only can pretty much most microbes cannot get across, but also, as you learned in 201, your skin is constantly being shed at the superficial most surface, and like literally the microbes just fall off with the dead skin cells. So that's kind of nice too. Okay, so both the keratin and then the actual shedding will be a mechanical, physical barrier. And then the mucous membrane's not as good, right? That's why we tell you like not to like rub your eyes or put your hands in your mouth, stuff like that, because those mucous membranes, they're not necessarily as good as the keratin, but they do help, right? So like think of like, even the mucus in your nose or like in your throat, it helps trap things in the mucus. And then particularly like in that ciliated pseudostratified epithelium that's in the trachea, it'll help move microbes that are trapped up towards your throat, and either, you kind of rudely spit, like hawk and spit it out, or, you kind of just clear your throat and you just swallow that, and then the stomach acids usually destroy most microbes. Another mechanical protection is simply the washing action of tears, urine, saliva. Just having that, again, things just washing away as far as saliva goes, again, swallowing, and then stomach acid taking care of it, tears, and I think it's pretty obvious, right? And the same idea with urine. So basically any opening in your body leading into the internal organs is prone to infection. So urine, not only is it usually acidic, sometimes it can actually be basic, that helps prevent microbes from establishing themselves, but also literally just going to the bathroom and peeing washes them away. Okay. We also have chemical protection. So sebum, right? Remember we have sebaceous glands in our skin. So not only does that help protect your skin, like keep it from cracking, again, and then causing those openings into our internal environment. However, the sebum actually has properties that help inhibit bacteria and fungal growth. So then perspiration, right? First of all, let's think about this. When you sweat, it offers a bit of a mechanical protection, right? Literally you're washing away things that would be on the surface of your skin. But perspiration also has a chemical in it, or a protein in it. Oops, did not mean to do that. Called dermacidin. So perspiration has something called DERMICID, dermacidin, in it. And basically this dermacidin is going to kill off lots of the bacteria as well. And then kind of following up on that, tears not only again kind of physically flush things out of your eye, but also contain lysozymes, so an enzyme that helps break down bacterial cells. And then other kind of chemical protection is the acidic pH of gastric juices, as I mentioned, vaginal secretions, and again, pH in urine can vary anywhere from like a pH of 4, which is fairly acidic, to up to a pH of 9, which is fairly basic. So again, that will help destroy bacteria. All right. Then internal defenses. So again, these are our antimicrobial substances, natural killer cells, phagocytic cells, inflammation, and fever. We'll take these one by one. So antimicrobial substances are just that. They discourage microbe growth. They're antimicrobial. So one category of them is something called an interferon, and these are basically going to interfere with viral replication. Okay, so basically, again, they interfere with viral replication. So they're these interferons are antivirals. There are something called complement proteins, and essentially they're going to enhance immune reactions. So they'll make fevers more, they'll cause macrophages to respond things in greater numbers, things like that. So any of these other things we're talking about, those complement proteins just increase their effectiveness. We have iron binding proteins. We talked a little about a couple of them. There's ferritin and then transferrin. So some bacteria are going to need abundant iron in order to grow. So another good thing about having those iron binding proteins is that it prevents the bacterial growth. Okay, and again, remember, iron is going to be very destructive to the body. So that's the other reason why we bind it. And then we have antimicrobial proteins. So just these antimicrobial proteins in a little bit more detail. They're very short peptides and they have a broad spectrum of antimicrobial activity. And what's interesting is microbes, right? The difficult thing with microbes is that they can quickly evolve to have immunity, right? We're seeing that with a lot of microbes these days that are resistant to different like antibiotics, right? But interestingly enough, these antimicrobial proteins, the microbes can't evolve, like out-evolve them, so they can't develop a resistance, which is really interesting, and scientists don't know exactly why that is. So, keep your eyes out for if you happen to hear any kind of new developments, because obviously this is going to be very important, especially as a lot of our drugs are no longer effective because, the microbes have evolved immunity to them. So one of the things I was mentioning before was that dermacidin. So that's produced by sweat glands. So again, to help kill off different bacteria. There's also thrombocidin, which is produced by platelets. Then we have these natural killer cells. So here you have an image of these natural killer cells killing off actually a tumor cell. So the red cell here is a tumor cell, and these are these natural killer cells. You can see them attacking a tumor cell. Okay, so that's what they do. They kill a variety of microbes and tumor cells. They're sort of floating around the blood, spleen, lymph nodes, red bone marrow. Again, continually patrolling the body. You can maybe think of them as cops, I guess. And so what you're seeing here, so once they recognize the cell as an enemy, so either a microbe or a tumor cell, they will bind to it, which is what you're seeing here, and they will release something called a perforin. And perforins are really, I don't know, I find them really fascinating. I think they're kind of cool. So basically these are proteins that then create holes in the plasma membrane, right? So these perforins will poke holes in the membrane of this cancer cell, this tumor cell. So what ends up happening when you poke a whole bunch of holes into the cell membrane, the cell is eventually going to basically simply explode and dies. So that's kind of how they work. Okay. And then they also have something else called a granzyme, which is kind of neat. So this granzymes can also enter the holes that's made by the perforins, and then they'll destroy the cell from the inside out, which is kind of crazy, which causes the cell to basically self-destruct. That is so neat. That's what apoptosis is. It's programmed cell death. So two different ways. They'll poke holes in it, and if that doesn't kill it by causing the cell to just simply explode, they'll release these granzymes, causing the cell to basically self-destruct from within. That's All right, phagocytosis, I think we all kind of know this. You're seeing an image here. So right here, oops, if I can get my little cursor to work. So microbes usually put off a chemical trail. So you see this large phagocyte following that chemical trail. That's known as chemotaxis. So when something follows a chemical trail, that's chemotaxis. Just a quick reminder, you do this, like if you happen to smell something that you really like, you go toward the smell, right? Or if you're like, oh, what is that smell in my house? Like, what died? You follow it until, it gets stronger and stronger until you find whatever it is. Anyway, so that's chemotaxis. The phagocyte will adhere to the microbe, it'll ingest it, and then lysosomes are going to break it down into smaller pieces, and basically, the microbe is dead. And it's basically what I just told you. And then any kind of, basically that's left over that can't be used, it's basically excreted out of the cell. And then your kidneys will flush that out. Then we have inflammation. So damaged cells are going to initiate this response. So here we have our epidermis, right, and then dermis. So you can see you've got a little cut. Microbes have entered because now we don't have that nice keratin layers protecting. These damaged cells will initiate this response saying, hey, we're damaged. And then again, there's that chemical cue also given up by microbes. And you see these phagocytes coming out. It looks like a macrophage here and then like a neutrophil right here. And basically the job of inflammation is to trap the microbes or whatever it is and begin tissue repair. So let's just kind of take this step by step. So here again, it looks like a neutrophil. Here we have a capillary. So basically as the cell is picking up on this signal, remember it, and they kind of show this here right in the middle of the lumen of the capillary. Remember, these are like rolling around along the surface of the blood vessel. So basically it picks up on that chemical cue and then it goes, oh, let me get through there. And it just squeezes through these tiny little openings. I don't know if you've ever seen those videos of like octopi getting through tiny little cracks and stuff, how they kind of just like squeeze right through things. It's kind of like that. Anyway, they adhere to the sides of the capillaries. That the term that they use is called margination. And then they enter that interstitial space by diapedesis. Okay, and they're guided by chemotaxis. Okay, so basically what happens is you also have vasodilation, mast cells, as well as damaged cells, and then basophils as well as mast cells are going to release different hormones. So histamine, you can see kinins, prostaglandins by the damaged cells, and then leukotrienes by the basophils and mast cells cause vasodilation. That vasodilation increases the permeability of the vessels, and basically that's right. Now those white blood cells can get through to the area of damage. Okay. The downside is that if cells can get out, other things can also get out, like red blood cells, so you get a bit of redness. It's very metabolically active in there. You have lots of cells fighting one another, so that metabolic activity causes heat. And again, it's not just the cells leaking out, but also fluid, so you also have edema, so a little bit of swelling in that area. Okay. Blood clotting factors will help trap the microbes. And then again, neutrophils, monocytes are going to get to that site. Hopefully, get a handle on any kind of foreign microbe, and then tissue repair can begin. Right? You've probably all seen it when something gets a little bit pussy, but it's actually in pus. Like if you kind of did like a smear on a slide, you'd see a whole bunch of phagocytes, damaged skin cells, and fluid. Okay, and you've probably have heard or at least seen an abscess. It's basically a lot of pus in a confined space, so it's like underneath closed skin. So basic example is a pimple is basically is a tiny little abscess. Boil is a larger one. Okay, an ulcer is an open sore. Okay? So here's a really gross one. So here, I don't know if you can tell, this is a cat. This is like what kind of example, but you can see the cat's ear here. This is a giant, it got into a fight with another cat. It got bit and caused an infection. So this is a giant bag of pus that had to be drained and drained and drained. Oh, horrifying. And then they actually put in kind of little stents or shunts so that it could keep draining on its own. Ugh, yucko. Like, don't let it get this bad if it's your cat. Just saying. Like, take it to the vet a lot sooner than that. All right, fever. So another second line defense. I think we all know what that is, right? Normally high body temperature. Usually during infections and inflammations. Basically, what ends up happening is that different microbes are going to cause release of a chemical called interleukin-1. And interleukin-1 basically causes your body to reset its natural thermostat to a higher level. And basically that fever will help inhibit bacterial growth. It'll help intensify those interferons, right, that interfere with viral replication, and also help speed up tissue repair. So a little bit of a fever is not necessarily a bad thing. I think we tend to have a tendency to like, oh my God, I've got a fever, I gotta, break it or get down. And, it does have a purpose. It's not a malfunction in your body. Obviously, if the fever is running too high for too long, then that's a different case. But a little bit of a temperature elevation is not necessarily something to fear or even necessarily want to hinder, because it's your body trying to heal you. Okay, so let's kind of review that real fast. We had antimicrobial substances. These were the interferons that interfere with viral replication. The complement system, which basically is going to upregulate anything that we just talked about, the inflammation response, the activity of the natural killer cells, all of that. The activity of the phagocytes, they just, again, enhance it. We had talked about iron binding proteins, antimicrobial proteins, which, again, kind of cool. Microbes do not evolve resistance to them. We talked about these natural killer cells seen in this image. Again, that they will attack microbes as well as tumor cells. Talked about phagocytic cells, talked about inflammation, right? And again, the process. So you have neutrophil, this one's a monocyte, and then neutrophils going to the site of damage, trying to trap the microbes, as well as blood vessels becoming vasodilated to help them squeeze through. And then fevers, okay? I'm going to stop here because the next step is going to be adaptive immunity, and that's a little bit more involved, and it's a good breaking spot. So I will see you guys next time.